Doctors have banned this practice because mothers start shooting babies out like machine guns.
Bullets where they shouldn't be, how not to have a baby, and you know what I always say, don't pull it out. Today we're breaking down and reacting to all of the unexpected medical moments and sarcastic injuries from Zeck Felms.
That doesn't sound right.
A popular parody YouTube channel. Let's dive right in.
If you crash while riding a motorcycle.
Motorcycle crashes are a real thing that we see in the emergency departments, and this graphic doesn't show any protective gear, so yes, you have a higher chance of causing a significant amount of trauma to your body.
Doctors would first make a cut on your neck, separating the head from the body, and the blood vessels are connected to another one.
We don't just jump to cutting somebody's neck and separating your head. Most common injuries relating to motorcycle accidents: head injuries, concussions, intracranial bleeding, fractures, scrapes, bruises, abrasions. Sometimes you'll see collapsed lungs due to either a rib puncturing the lung or just a blunt force trauma to the chest.
The muscles, bones, and tendons are precisely cut and left in their original positions. The surgery would take hours to reconnect everything.
Transplanting somebody's head. We can reattach muscles, the tendons, the blood vessels, but when it comes to the nervous system and the functionality of it there, we're not at the ability to have that function for us yet.
The table starts to spin the mother around as she was giving birth, and this could generate up to 8 Gs of force.
What normally happens when somebody's giving birth, there's many different mechanisms that are happening. Hormonal signaling, the uterus starts contracting, trying to help push the baby down, move the process to where the baby gets closer to the outer world, basically.
Doctors have banned this practice because mothers start shooting babies out like machine guns.
They do show a bunch of fluids going around the room. Yes, that could happen. The amniotic fluid, you would have blood, you might have urine, and then you may even have feces as well.
You'll fart, pee, puke, and poop.
If your face suddenly turns paralyzed, that's a bad sign.
If you have difficulties moving your face, difficulties smiling, there's asymmetry. That is a concern that you might be having a stroke. Could be something different, but that is our number one concern because stroke symptoms are time sensitive.
Try to smile. If only one side of your face moves, that's a serious warning sign. Now, raise your arm in front of you and keep it steady for a few seconds.
Oh, you can have some interventions within the first 24 hours, but that's only if there's what we call a large vessel occlusion, where the doctor can go in and actually take out the blood clot. Outside of that, there's not much to do except say, this is the damage that happened. This is what we're going to do to figure out why you had this happen and what we can do to help prevent them from happening in the future.
He slipped on falling on a drill bit, penetrating from his right eye to behind his ear.
The eyeball is going to be gone at this point. The damage to the eye is probably irreparable, but then the question ends up being what type of brain trauma injury has occurred. But what do I always say? Don't pull it out. Leave it in place, get to the hospital ASAP.
Rushed quickly to the hospital. The doctors forgot that the metal should be removed before the MRI.
We can't put people in an MRI machine with metal because the M stands for magnetic. It will pull, rip, and move and cause damage not only to the machine, but it can kill the person and damage maybe other people around.
This resulted in an unexpected outcome. The drill bit ended up in his and so the man became pregnant.
Oh my goodness. We do have people that come in with trauma to the rectum and foreign bodies up in that area. You have to worry about perforated bowel as well as trauma to the anus, lacerations, abrasions, contusions, blood loss, as well as fecal material within the abdomen, increasing the risk of sepsis.
The bullet was shot and lodged in his chest, but doctors said it was too close to his brain, so they decided to leave it there.
Chilling in your heart, they probably don't want that hanging out in there. Reasons why you would actually remove a bullet: brain, spinal cord, joints. Majority of the time, we leave the bullet in.
He grew up and led a normal life, but at the age of 78, his belly began to grow, so he went to the hospital for tests.
Having nonspecific abdominal distension over a period of time, you think mass, tumor, obstruction, liver disease. When somebody comes to the emergency department, we'll actually do a workup and we'll probably just get basic blood work, kidney function, get a CT scan of your abdomen after we do a physical exam.
He discovered he was pregnant, and 9 months later, he gave birth to a bullet baby.
If your eyes point in different directions,
Yep.
a doctor will make a small incision in your eye.
This person is being depicted as having bilateral exotropia. The eyes are looking laterally. This could be due to a nerve problem. This could be due to a muscle problem.
He licks the buttons on the controller that control the movements in the game.
We are never getting GTA 6.
You have people that are able to move their eyes to activate devices, or even Neuralink, which is actually in an individual now, to be able to reactivate areas that weren't active before due to neurologic injury.
When he was a child, he fell off his bike and his body was paralyzed except for his tongue.
Spinal cord or brain injury. His body was paralyzed except for his tongue, but he doesn't have a trach, hole in his neck for an airway. Then it's a lower cervical spine injury, most likely.
If you took out all the bones in your body,
Oh, could you actually remove the skeleton out of our body? Unlikely.
removing the bones from your body is technically possible, but you would look like my bulldog's nuts. However, if you managed to replace them with a Lego skeleton, you probably wouldn't even be able to stand up.
If you have such a badly destroyed bone, an orthopedic surgeon will be putting different pieces of metal in your body. Sometimes they're metal rods, sometimes they're plates with screws.
If you tear your fingernail like this, you may experience severe pain.
Very painful for this to happen. Increased risk of infection, increased risk of what's called a paronychia, which is an infection in an area where you can get some purulent material and discharge, which is easily treated by just a small puncture to that area.
Instead, tie a knot in some string. Attach it to a door and make sure it opens outward.
Laughing at ridiculous medical clips like this is one way to relieve stresses of life. But if your nervous system is still a little on edge after a long day, you could also reach for Chillax by my company Life Happens to help your body relax when it gets stuck in that high alert mode. Check it out at lifehappens.com or on Amazon.
Now, when someone opens the door,
Oh my gosh. The skeletal structure and the muscles look pretty cool. It looks like right out of an anatomy textbook, but this degloving of the whole skin off your body, unlikely. But we do see it happen to different parts of the body. I've seen it happen to hands, arms, feet. I've seen it happen to scalps before due to significant trauma.
place it into the baby's nose, then gently suck through the mouthpiece to pull out their mucus.
Yeah, okay. These things do exist. These are nasal aspirators the parent or the adult uses for manual suction. You can suck out into the tubing or into the device and then discard it.
Instead of sucking, you should blow hard so the baby will inflate like a balloon and explode.
Do not blow air in, no, so that can mess with somebody's airway, could hyperinflate the lung, and can cause barotrauma as well as trauma to the upper airway. Will you cause your child's head to explode? No, but you can cause undue pressure, pain, discomfort to an individual. Very interesting clips from Zeck Felms, some kind of accurate, some not, or a little twist or a take on their own opinion. If you guys enjoyed my reaction to this and want me to do more from this creator, let me know. And as always, do me a favor, definitely binge watch this playlist right here, and make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.